All right, guys, you've heard the saying, what's in it for me? In this video, we're going to talk about what's in it for the referring physician. Now, I'm going to take away all the low-hanging fruit because we're going to make this a hard exercise. You're not allowed to say that you're an amazing therapist and you provide convenience and you provide expertise and you provide one-on-one. You're not allowed to say that the patient's going to see the same therapist every time. Take all of those reasons away. At the end of the day, what is in it for the physician? What are you specifically offering that physician to make the physician's life easier? And I don't care if you're cash-based only. I don't care if you're third-party payer, if you're in network with Medicare, out of network with everything else. Forget all that stuff. That stuff is just details. The bottom line is the physician, whomever the physician is seeing multiple 20, 30, 40 patients a day. Most of those patients have musculoskeletal issues. Some of them have neurologic issues. There's always something that you would help to improve. So the question is, again, what is your exact value proposition? What do you deliver? What is the outcome that you can provide that physician? And I guarantee it's easier than you think. So for me, I want to share an experience with you guys in this video. I can remember, this would have been 2007. We had just moved to Ohio. We had just opened our clinic in the Ohio market. And we were coming into a town where we were the only other private practice. There was one other private practice that had been around for 30 plus years. These guys were deep in the community, and I was an outsider. And so we would do the luncheons, we'd do the meet and greets, we'd talk to the physicians. And I can remember one specific physician. He was a primary care doc. He had no financial ties to anyone. And he sat with me and he said, "Why would I send anyone to you? What is it that is special about you? Because I'm happy with the people who are seeing my patients right now." And that took me aback. I was like, what do I do? What do I say to this? I knew the people that were treating his patients, they were good therapists. They worked just as hard, probably harder than I do, because they were running a busy clinic and they had been around forever. And so imagine trying to change 20, 30 years of history. Imagine trying to change a habit. If you have a habit right now, maybe every morning you get up, you put on your right slipper first, or you brush your teeth, or you do this, or you do that. Imagine trying tomorrow to do something differently and continuing to do something differently. We all know we should eat better. I should eat more vegetables. It's logic. I know I feel better when I do, but it's a habit that I don't. It's not a habit for me to go buy them, have them ready, have them available. And so habits are hard. Okay, so back to the point at hand. So he asked me that. He said, "Why should I send them to you?" And the only response that I could really come up with was, look, I understand the therapists you're sending to right now are doing a great job. And your patients are happy and you're happy. I'm not telling you to change anything. But what I will tell you is the therapy clinic that your patients are going to right now gets busy, just like any other therapy clinic. And we're the new kids on the block. I'm not saying we're better or worse. I'm saying that if you have a patient that needs to get in, I can get the patient in within 24 hours. I guarantee I will never hurt one of your patients. I might not make every patient of yours better, but I will never let one come back to you because they're in more pain. And I guarantee that your patients will never receive a surprise bill, because I know what it's like to go to a physician's office or any medical provider, have no idea how much it's cost, have no idea how much the insurance is going to pay, and then all of a sudden 3 months later you get a $600 bill in the mail. That is never going to happen. And so those were my 3 value offers. I didn't say I was the best therapist. I didn't say I had the best service. I didn't claim to have the best equipment, because none of that stuff is true. I said, look, I can get your patients in quick, and if the other clinic has got a 2-3 week wait period, your patients might want to come to me. I guarantee your patients are not going to get a surprise bill, and I guarantee your patient's not going to come back to you complaining that I made them worse. Now, at that point, I had already been a therapist for years. I had already owned a clinic for years. So I knew what was important to the physician. Other physicians, we would go in and we would say, look, we make the process easy. We hardly ever request any information from you as the referring provider. We verify all coverage on patients before they start therapy, and we tell them exactly what the cost is going to be, and we guarantee that cost so that there are no surprises, even if the insurance changes. We never forward or balance bill the patient if it wasn't agreed to before service was delivered. You know, at the end of the day, at least my opinion, the docs in my area, Cincinnati, Dayton, Ohio area, they're more than busy enough. They're not trying to attract more new patients. They have a line of patients out the door. They don't care if they're the best. They don't care if patients love them. They're busy enough. So for me to say I'm going to make your patient's experience better doesn't really mean much to them. What they want is they want me not to cause them problems. They want me not to take more time out of their schedule, not to put more demands on their office staff. You know, I know therapists that are constantly requesting medical records, constantly requesting operative reports, constantly reaching out to the surgeon. Maybe there's a doc or two out there that appreciates that values that, but the vast majority of them have been practicing more than a couple years, and they're in the mindset of, look, the patient just needs to feel better. If you can do it, awesome. If you can't do it, that's okay. And let's move on. You know, just don't make their life more difficult. That is a huge value proposition. All right, guys, now I want to hear from you. What do you think referring physicians actually want? What is the greatest benefit, the single greatest value offer you can deliver to them? And please do not make it about the patient, right? It's just one of those things, like, I do things to help other people, no doubt. But I'm not necessarily going to change my life or change something I do during the day to make somebody else's life better unless it also makes my life better. You know, and there has to be a major improvement to my life for me to change a routine that's been ingrained for 10, 15, 20 years. So let's start sharing ideas. Post them in the YouTube comments. Let's see what kind of traction this video can get. And of course, like the video if you would. It's super simple to click the thumbs up button. It goes a long way to support the channel. Subscribe to the channel if you haven't, and share the video if you think somebody else would benefit from this information. Guys, I'll catch you on the next one.